evening, it's Deanna. I wanted to talk about bladder issues tonight. Bladder issues and MS. Bladder or urinary problems are one of those things that aren't discussed very often in MS. For me, it was one of the main symptoms that took me out of the workforce along with fatigue, but I want to explain it a little bit. Since I don't know, maybe you have bladder issues and you're not sure what's going on, and maybe you're faced with some decisions or some embarrassment and you're not sure what to do about it. So maybe I can answer a couple of your questions. Before I found out about bladder issues I was having, I went to see my general practitioner, my main internist doctor, and she found that I had urinary tract infections. Now, I'd never had them before in my life, but okay, so she found it. We tried to treat it with antibiotics, and that didn't work. It was stubborn, so I kept getting them over and over again. So at that point, feeling kind of crappy, and she made sure to send me to a urologist so that we could see what was going on. No, I'd never had these problems before, so it was new to me, and I kind of always thought that urologists were for men, but I found out women could go to them too, especially if spinal cord issues or if you had spinal cord problems like paralysis or MS or the like. So after I went to see my urologist, we did a urinary output diary, and we looked at how much I was going, how many times a day, how much each time, and that involved some measurements, and we did that for about 3 to 4 weeks actually, and I always felt like I had the urgency to go. Okay, I'd go to the bathroom. Boy, it was hard to go to the bathroom, meaning I'd sit there and nothing would happen. And so I would go, measure, not much coming out. I'd leave within 10 minutes, an extreme urge to have to go again. Does this sound like anything you're going through or have been through? Okay, as time went by, I went through different types of tests. And one was a cystoscopy, where they actually took a scope and looked inside my bladder just to make sure there were no tumors or blockages. And the second was, I think they call it I'm not sure, urogenic testing? I forgot the name. It's been such a long time, but they use catheters and they measure the pressure at which you're going to the bathroom at. They're measuring how much pressure it's taking for you to go to the bathroom, and they're measuring, they had this fancy toilet, and they're measuring basically how hard it hits. Basically, how much are you straining? For me, I was straining about the amount I would for a bowel movement, like being constipated. It was bad, and nothing was happening, and that's pretty dangerous. You don't want to do that to those urinary muscles, because it can cause some problems. So after that, we discovered that I had something called mixed bladder syndrome, mixed neurogenic bladder. I had failure to empty, and I had frequency. Okay, so we started treating this with Ditropan. Ditropan's a popular product. There's Detrol. There's many on the market right now, but the one I use is called an oxytrol patch, and that helps with the urgency. But what we discovered I had to do, and it's helped me a lot, and a lot of people are very frightened to do it, is self-intermittent catheterization. I want to explain that to you. It's what it sounds like, and I will explain it from a female perspective. I use catheters. It's hard to see in the package. It's a 6-inch catheter. They come sterile, and I don't use a sterile method. I use a clean method. There's a catheter. This is one that I use, and it's made of silicone. And you have the eyelets. It's kind of hard to see. The eyelets and the funnel. And a catheter will last me about a week. I have a whole kit that I use. I use alcohol pads, swabs. I use antiseptic gel. I use, this is actually a hydrophilic, and lubrication is not necessary, but usually I have some lube with me. And it took me about a week to learn my anatomy, but once that happened, it was a breeze. And actually, catheterizing was like, it's become like physical therapy for the bladder. And that's the way my urogynecologist explained it to me. You know, you have to do it. I cath about, that's what they call it, cathing, about 6 times per day. And at night, and sometimes one time in the middle of the night if I have to. Depends how much I drink. It's like second nature to me. It's no problem, and I wish I could teach my friends. They could, drink beer a lot easier. It's a piece of cake. But I'm going to post this on YouTube, and I'm going to call it Bladder Issues and MS. Please feel free to post a comment, ask a question, experience, whatever. I'll be glad to answer it. Take care. Have a good night. Stay well.